This next video clip deals with some of the examination basics for lumbar extension. Again, in clinical practice, we need to have the patient's shirt tucked upward so that we can see the T12 all the way down to the L5, S1 motion segment. No clothing blocking your view of the active motion. Okay? We're going to have Hannah backward bend several different ways, and one of the biggest things we're going to look for, and one of the principal things we'll address in this video clip, is early excessive motion. Most typically, we see that at either the L4 or the L5 motion segment. Now, one way to potentially see that in a patient who has discogenic instability is have the patient just lift their chest bone up and forward, like that. And then come down again and lift your chest bone up and forward and come back. That small amount of extension, if you could keep doing that for me, Hannah, should not recruit movement into the L4 or L5 motion segment. If you see those two segments move into extension first, and if you see a fair amount of motion, a fair amount of extension in those two segments, just by virtue of having the patient lift their chest bone up and forward, that may potentially be a visual indicator of instability in the direction of extension. How else can we look for that? We can look for early excessive extension at L4 and L5 by just having the patient push their pelvis forward a little bit. Okay? So do that for me, Hannah. Just let the pelvis come forward, okay, and back, and forward and back. Pushing the pelvis forward and back, we should still see lordosis develop through the entire lumbar spine, all 5 segments. Again, if we see a lot of motion at L4 or L5 as the patient pushes their pelvis forward, again, that is a potential visual indicator of excessive motion in the direction of extension at either L4 or L5. We're going to keep the video going now, and Hannah, we're going to have you get up on your side, on your right side on the table. And let's look at that just a little bit further. If your eye showed you early excessive motion in the direction of extension, have the patient lie on the table. Take a grip from the front of the lower leg and move Hannah's thighs back into extension, which will anteriorly tilt the pelvis. And we'll look with our eyes for excessive motion at the L4 or the L5 segment. After looking at it visually, we can palpate L4 and see and feel for motion in L5. Notice how small this movement is, the movement of the legs. We should not feel nor see a lot of lumbar extension at those 2 lowest segments. Okay? If we do, if we see a lot of extension and we feel a lot of extension, that's another clinical test that points toward excessive mobility in the direction of extension. Of course, you can take this test up to other motion segments as well, all the way through the thoracolumbar junction as you test for passive segmental extension at all segments.